we do want to talk about a story. Well, I guess cuts to the health system are an ongoing story, but I saw a story in the weekend, and it just felt like it had been buried, because it was about in New Zealand at the moment, a whooping cough epidemic. And it just kind of felt weird that this was coming out on a Saturday. And I haven't really heard anyone talk about it. And then the article on, might have been RNZ, I'm not sure, or One News, talked about this whooping cough epidemic was announced on the same day as the national-led government was talking about all the new cuts coming to the health system. Bit of a slight irony there, you know. So I contacted Northland emergency doctor, Dr. Gary Payinda, and said, would you come on and chat about it? But since then, chewy, more stuff's happened in the health system and cuts. So let's welcome to the show, Gary. Gary, thank you so much for joining us tonight.
Hi guys, how's it going?
Yeah, it's going really, really well. Now, I'd like to kind of get the vibe of that first of all. I saw a headline on the ODT maybe yesterday about whooping cough being sort of escalating in the southern part of the country. But when it talks about epidemic, I mean, most people think because of the last 4 years, pandemic, virus, that kind of stuff. What do we mean when we're talking about an epidemic?
Well, pertussis does have cyclical peaks and troughs, right? It sort of comes and goes. It sort of burns its way through the community. Numbers much lower if people are well vaccinated, but as you probably know, people are not well vaccinated, and that's really the problem, right? There's a lot of kids out there who are susceptible to pertussis, and of course, this is a disease that we predominantly are worried about because of its effects on infants. So kids under 12 months of age can get really amazing amounts of respiratory obstruction and apneas where they stop breathing and can even die from pertussis. And that's not common in older age groups and in adults. Right. It can make you sick. It can give you sort of a long-term cough. In rare cases, it can be serious or deadly, but it's really the fatalities happen in that infant age group. And so we need people to be vaccinated, and they quite simply are not. And that's why you're seeing this outbreak. It's as predictable as anything. You could say the same for measles, rubella, you name it. We have a whole bunch of vaccine preventable diseases, and people are not availing themselves, unfortunately.
I think all people should need to do for vaccination is see a picture of an infant with whooping cough. I mean, the poor wee thing. And it's funny you would say that, Gary. Obviously, you know, I understand that people, I only ever think about whooping cough when I think about infants, but you know, you're saying because that's where it's dangerous, yeah? More dangerous.
Yeah, although I don't want to minimize how bad it is if you have to go through it, even as a child or as an adult. You can cough so much that you break ribs, especially in the elderly. I mean, think about that. That's awful. You can cough so much that you lose control of your bowels or become incontinent of urine. You can cough so much and for so long without a breath that you actually black out. So yeah, pertussis is not fun. And the whoop is essentially the inspiratory sound of a person struggling to get a breath in. It's not nice.
We've all had sorts of public conversations around vaccines in the last 4 years. Just in general, I don't need specifics or numbers from you, but are we seeing vaccination rates drop off in the last 4 years, or is this a trend from pre-COVID as well?
Yeah, so I work up in Northland where rates have traditionally been extremely low. So what we're now seeing is that the country overall is having some rates as bad as the worst rates used to be regionally. And so, yeah, since COVID, since the amazing amount of misinformation and disinformation, since people have been getting their health guidance and their vaccine advice from Facebook rather than from a trusted health professional, you've seen rates go down and down. And I don't want to say that it's all misinformation and disinformation. That's a big part of it. But there's also issues of access. People come to me in the ED from rural and remote places, sometimes days later than they should, telling me it was really hard for them to get petrol money together to take the drive in here from Rawene or Cayo. It's not easy for some people to manage the essentials. And I think all of that plays into horrendously low vaccination rates. When they're telling you that you need to keep vaccination rates up around 95%, and lots of places are at 76%, you know that it's a ticking time bomb. And when you're told the national immunization rate is such and such, you have to realize that hides the fact of regional variations, where you can have 20 to 30% lower vaccination rates in some communities than others. So, and of course, those communities are then at risk of having epidemics come through like wildfire.
Again, more of a general question, but I'd be interested if you've experienced this. When I used to work at ZB, I can remember it was probably 2010, 2011, there was a measles outbreak in Waikato, and there was a whole bunch of people who didn't have their kids vaccinated, and it had nothing to do with sort of the COVID. It was more like didn't have to worry about it. But what happened then was all of a sudden, all these people who are probably more greenies and didn't want that part of it, all of a sudden started getting everyone vaccinated because they saw the result of what non-vaccinations were. When you see this kind of thing in public, generally the whooping cough coming up, does that spark people in general to sort it out, or do they just continue to ignore and continue to stay unvaccinated en masse?
Well, I think it goes both ways. Some people will suddenly pop up and say, I want the vaccine now. And then others will go down fighting. And I mean, during COVID, there were some really epic cases of people in the UK and in the US being intubated for COVID, being told that there was a very high likelihood that they wouldn't survive because they had, multi-system problems, multi-organ issues, and still denying the existence of the virus. So, there's all sorts of people in the world, and there's all sorts of reactions to dangerous situations. I think vaccination is one of those things where we are just doomed to repeat history again and again.
Right.
And I mean, the reality is the better your vaccinations work, the more you can forget about them and take them for granted. And you can easily say, well, I don't want my kid vaccinated because all the other kids are, and my kid's safe. Ironically, these are often parents who themselves have been vaccinated, so they are safe. And then as soon as there is the first big media wave where they start talking about a tragic loss of an 8-month-old child, then it hits communities and they start saying, where is my vaccination van? Why isn't there one in my community? And I suppose that's just human nature. Do you think?
Yeah, maybe. Why haven't you helped me with my vaccination that I refused? It's your responsibility to help me. Get it?
Yeah.
Hey, the other part of this conversation that leads into is a conversation around funding, and I would like to ask you about this. This is the original story where the headline says on the day public health officials announced a whooping cough epidemic, staff at the National Public Health Services were told their jobs were on the line. Since then, nearly 1,500 more Te Whatu Ora roles face the axe. I just did a tweet recently that based on its Margie Upper, isn't it, the CE, where she says, Te Whatu Ora has made some good progress towards living within our means, but we are still spending more than we have in our budget. Now, the tweet that I just did, and I won't read it out word for word, said something like, when they talk about living within their means, what they're talking about is an arbitrary number that this government has decided to give them. And there's another way they could live within their means, which is the government could just make an arbitrary number higher and give them more. But what they're trying to do is cut back and give them less. I also want to talk to you about when there was a story the other day about $42 million going into healthcare for new doctors. So on one hand, the government seems to be saying, look what we're doing, all this money for doctors. And then on the other side, it's like, you don't have enough money to actually staff your organization as well as you can. Too long, that question, big ideas, but love your thoughts.
Yeah, the announcement of more doctors was really fascinating because at first blush, you want to be reasonable and say, wow, Shane Reti and Lester Levy have found the money to put an additional 42 million into 50 doctor roles, about 75 nursing roles, and 12 million of that is for like minor improvements to hospitals. And so initially you want to say, this is fantastic, we need more of this. Then in talking to people about the actual details of this, you learn that it's not an additional 42 million. They have repurposed this money from elsewhere within the budget.
Of course they have.
And again, I'm not a lawyer, a politician, or whatever, but this is what smart people have said, and I believe it to be true. They've not come up with more money; they've repurposed money. So you have to start asking yourself, all of the horrendous cutbacks in healthcare staffing, these recruitment freezes, the fact that my colleagues say they cannot fill roles. People leave the Te and the role will not even be advertised. Wow. And so it just goes on as a vacancy. And then other people are having to work ungodly amounts of hours to try to compensate. We have, I was going to say stories. They're not stories. They're real. I know these people who are foregoing their breaks because they are so understaffed. They need to stay on duty and eat their lunch at their job, at their work, because they don't feel that they can safely go away. What used to be 2 staff workers positions has now been reduced to 1. So, so going back to the 50 doctors, it might be a start if it was in genuine funding, but it's been taken from somewhere else. And then the bigger question should be that the journalists are not asking them is, wow, 42 million sounds like a lot of money to a regular person. And it is, but it's actually the money they're putting into these new doctors and nurses, it satisfies 3% of the shortage.
Right.
In the case of doctors, 3%. In the case of nurses, about 3.5%. So this is pissing in the wind. It's craziness that they would have a media photo opportunity in an underserved area with like a little mini press conference to announce that they have repurposed 3% of doctors and nurses staff deficit. So what about the other 97% that we're missing? Does that get a photo opportunity? Does that have its own little show on the news? Of course not.
So if that's 3%, that means you've got a times by about 33. That's over $1 billion needed to actually fulfill the shortfall. So
Shane Reti said, I think it was half a year ago, that there were something like 485 GP positions that were vacant that needed to be filled nationwide. That's a lot. You add that to the best estimate we have of the hospital doctors, missing about 1,000, I'm going to look this number up because I don't want to get it wrong, 1,140. So that comes out to 1,600 doctors that we were down. And of course, that number probably has gotten a little bit worse because there has been attrition and people have left the service and have left the country in some cases. I don't need to tell you that right now it's not a hot time to want to go into general practice.
Yeah.
So,
just to work it out exactly, I just did it. It's 1.386 billion. And because we do like to beat a dead horse here sometimes, I'm just going to remind people, 3 billion to landlords, 14 billion in tax cuts. And what I hear you saying is the money that we need for the healthcare, in addition, new money, you're talking about repurposing money. So new money is, say, 1.4 billion. So half of what we're giving the landlords would suffice the system that we need to get set up, if we could.
Yeah, Pat, you also don't want to ask what could we get for another billion. If you take just a fraction of the money that we gave to landlords, you could pay for free dental care for every New Zealander. I mean, come on. The magnitude of the money that went to the landlords is astronomical. It's $2.9 billion in tax deductibility that they got. And okay, I want to make it clear. I've had some personal interactions where people said, you know, my elderly relative has a rental unit. It's what's going to get them through retirement. Mm-hmm. And to that, I would say I have every feeling for them. And we could easily government could have easily crafted a law that helped the humble mom and pop landlords with maybe one extra unit. And instead, they gave 2.9 billion even to the people with 70 rental units, even to the multimillionaires. They estimate that the top 300 landlords will each make $1 million extra a year as a result of these tax breaks. That did not need to happen.
And we're going to talk about this later in the show, but when you talk about the money, there's a question put to Christopher Luxon today, or not today, we're playing it today, from RNZ about when are we going to get back into surplus? Oh, yep, I can't commit to that right now. But you guys said 25, 26. Are you still? No, we can't talk about that now because they've got nothing in the coffers because they've given it all away, which also means there's nothing in the coffers to provide this extra new money that the health system needs. The piggy bank's empty. Chewy, you've been very quiet sitting here listening to me and Gary
What
talk.
did I say last night? I said you need to be concerned when I'm being real quiet.
Okay.
I think you guys are being very negative, and I want to highlight some of the positives here. Sure, nursing graduates don't have jobs. Sure, we've got hospitals with no doctors, which to my mind is I don't think it's a hospital anymore. I think it's just a building. And let's just look at the wins. Milo is in every staff room now. That's guaranteed. He's done that. That's done. Like, that's a win, right? We're talking about the big stuff. Sure, we've come out of a global pandemic. Sure, everybody acknowledges there's probably another one on the way at some point in the near future. We don't need a robust health system that's ready for that. We don't need something that can deal with a very predictable pandemic of a childhood illness that has killed someone in Australia this week. It's expensive. Can't afford it. It's like going to the supermarket and asking mum if you can have a chocolate bar. Healthcare is the chocolate bar in the trolley. We can't get it. Can't get it. Landlord tax cuts. That's definitely at the front of the trolley. This government, like I've been saying, they're wreckers and they're vandals. They're economic vandals that are taking the things that we have collectively paid for over generations and built up, and now they're swinging the axe. And we have cashed up politicians and cashed up backers of those politicians ready to swoop in for the fire sale that is coming. They are going to privatize everything. They are going to try and pull off what the Tories in England have been doing too slowly for Lester Levy. He wants to turbocharge this. If that man could drive a bulldozer through every hospital emergency ward in the country, I believe he would with a smile on his face. You
left one thing out. You left one thing out, Chewy.
What's that?
$216 million was set aside so they could have the excise tax on heated tobacco products so that one company, Philip Morris, could get more customers, more profit, more money, more sales. This whole scene is wretched. Somehow they found the money to help Philip Morris out, but they're not finding the money to help education or health or the police out. It is dastardly.
I completely forgot about boiled tobacco products.
Yeah, let's have a look at that.
Terrible product.
Because we haven't put it in the show notes for people, but just so you know, there's a story on One News tonight exactly about this topic to do with the health system cuts. Now, nobody's necessarily prepared to comment on this in a professional manner, but I'm sure all of us will have some feels when you see what One News revealed about some of the people that are being cut are also some of the people that are supposed to be helping get the number of smokers down. And let me just tell you this, to keep an eye on, whānau, it's a very small increase, but technically smoking, the number of people smoking has increased since this government's started. It's only gone from 6.8% to 6.9%, it says it in the story, but technically that's the graph moving in the wrong way for this 2025 objective. Let's have a quick look.
Those proposed Health NZ cuts include specialists who help Kiwis quit smoking.
There you go.
That's despite the government revealing a new smoke-free action plan today with a focus on improving access.
A smoke-free action plan whilst they get rid of professionals to help quit smoking. Got it.
To services to help smokers quit. Experts say the proposed cuts make a mockery of the plan, as Jacob Johnson reports.
Time is running out to starve out cigarette use, with a goal to get smoking rates under 5% by the end of 2025. Many are still struggling to give up.
I'm down to 3 or 4 cigarettes a day instead of a pack a day.
It's hard to stop. It's like breakfast and dinner, lunch.
In order to achieve the smoke-free 2025 goal, 80,000 people need to quit over the next year. The latest figures show daily smoking rates are at 6.9%, up from 6.8% the previous year.
So, an increase. Very small. If it was a political poll, you'd say margin of error, but it is going in the wrong direction.
We did kind of, to some extent, take our eye off the ball over the last year.
Casey Costello today announcing a final...
Sorry, understatement of the year. They didn't take their eye off the ball. They moved away and let the ball come straight through and knock everything over. They helped the ball knock the wickets over.
Push to try and get there based on 4 pillars. Reducing uptake by making cigarettes harder to get, increasing quit attempts with a marketing blitz and incentive schemes, supporting those who have quit with more products, and improving access to quit services.
When you're at the doctors and they refer you to quit smoking service, that had kind of dropped away.
But just hours later, the Public Service Union claimed Te Whatu Ora was looking to cut its dedicated smoke-free team.
It sounds like one arm of government not talking to the other arm. So that's going to particularly cripple even some of the potential benefits that might have come about through this new plan.
Casey Costello disagrees, telling One News many of the quit services come from contracted community providers like this one in South Auckland.
The other services that are being cut, I believe, are those that help to coordinate, monitor and support some of those community providers.
The government's faced scrutiny over its stance on smoking since day one, repealing plans for a law that would ban the sale of cigarettes to anyone born after 2008, reduce the number of stores that can sell tobacco, and remove nicotine from cigarettes. Casey Costello's also been criticised for halving the excise tax on heated tobacco products. This health professor says her new plan lacks ambition.
There's nothing particularly inspiring or new. It feels like a very light touch, and I just don't think it's going to cut the mustard.
We're reinvigorating what was working and driving that connection.
She maintains the 5% goal is achievable with just 13 months to go.
There you go. 80,000 people in the next 13 months have to stop smoking to achieve that target, and currently, incrementally, tinily, it's on the increase. Gary, like I said, I know we're not necessarily got all the nuts and bolts about this, but surely you've got something that you can offer us about what you're seeing in that story, which is indicative of what we're seeing in the health system.
Well, what can I say that wasn't said in the piece? Big Tobacco could not have found a better government, a more friendly government to help their aims than this one. Literally cutting the excise tax in half in order for one company alone, Philip Morris, to sell more heated tobacco products. It's atrocious. It's insane. Getting rid of what was widely acclaimed as the world-leading legislation to reduce tobacco deaths and tobacco harm. They canned it. They canned all the elements of it wholesale, even if you were a little bit against one aspect of it, you certainly would have let through the non-controversial bits of it. Instead, they threw away all of the aspects, reducing the number of stores, reducing nicotine content, etc. This is a pro-tobacco government. There's no two ways about it. And I don't know if you've talked about this before, but if you look at the tentacles of Philip Morris and of big tobacco that reach into this government, there's too many coincidences. We've got ministers that were tobacco lobbyists for Philip Morris. We have heads of campaigns for one of the three coalition partners who left the campaign, running the campaign when they got into power, and went to work for Philip Morris. It's wild. It's awful. And I feel like this is a government made up of lobbyists rather than of health advocates. And yeah.
I think the one thing I'll disagree with you on, Gary, is when you said they were tobacco lobbyists, because at me, it basically seems that they probably still are. They may not admit that, but I don't know if the were thing I can agree with, because if they're not still playing that role, then they're doing better than any other tobacco lobbyists, aren't they? Getting stuff through.
Yeah.
Chewy?
Yeah, I lost respect for the health minister right about the time that he did not come out more strongly against smoking and against tobacco and in favor of the smoke-free legislation. I don't know how you can be a doctor and do anything that would promote tobacco use in society. It's atrocious. It's a huge killer. And it doesn't just cause lung cancer or emphysema. Those are bad enough. It also contributes, as you know, to heart attacks and cancers of all kinds. And to think that we would be helping that business along is, to me, unconscionable.
Hey, Gary, thanks so much for joining us tonight. Chewy, is there anything else you want to ask or mention before we let Gary go?
No, I just want to thank you for coming on the show again, Gary. You're an absolute champion, and it's great to have someone come in and really pull for your colleagues.
Yeah,
I'm more than happy to be here. I think it will be a good thing if more doctors speak up and speak out. And I want to just can I have 1 minute to speak to my colleagues?
You can have as long as you want, Gary. We'll leave
Yeah,
if
so
you want. You can have the whole show.
having gone through some unpleasant situations with my own, let's just say, patient advocacy, I would say this to doctors that are fearful of speaking up, who are fearful of censure or worried about their jobs. I would reiterate that as long as you're speaking in a personal capacity, Te Whatu Ora or any other health employer can't censor you. And even more to the point, you don't just have the right to speak up, you have an obligation to, under the Medical Council of New Zealand, which is very explicit in saying to doctors that we've got to advocate not just for the patient in front of us, but for patients in general. So I hope that frees up some concerned doctors out there to speak up, to let us know how things are going, both the good and the bad, and to not be frightened.
We obviously get the subtext of what you're saying, Gary. My question for you personally, my question to you is, has this been the fear of speaking up for doctors? Is this more of a reality under this current government? Like, has it become more pressured? I'm going to say, you haven't said, but to like be a good doctor and not speak out under this guy than the last lot? Or is it pretty much always potentially a bit of an embarrassment to whatever government if doctors speak out?
I think any government wouldn't. I mean, they're politicians, right? They don't want negative publicity. So I understand that any government wouldn't want it, but this government has had sort of record numbers of non-disclosure agreements signed. It's been very quick to gaslight healthcare workers. So, you know, when the nurses said, "Hey, we're understaffed,"
Yeah.
we are understaffed by about 4,000 nurses. Yes, government has hired, is it 1,200 or 1,500, gotten us about halfway there, but that's all that was budgeted for. And so after that, the government essentially said, we've hired too many, we've over-recruited, and we are in a surplus situation. Meanwhile, nurses were looking at their wards and at their EDs and their ICUs saying, what are you talking about? We've over-recruited. We're on a skeleton crew here. So I'd say this government has been more unique than other ones I recognize from the past 17 years living here and working here in Northland, for creating its own alternate reality. It manufactures a world in which, you know, Levy recently was saying that Health New Zealand doesn't need extra money. It's doing fine. And in fact, he needs to cut $1.4 billion more from the Health New Zealand budget. Mm-hmm. So if you can make sense of that one for me, patients know that it's absurd. Staff know it's absurd. And you're starting to see some people come out and say it. And I mean, the sad thing is a lot of the ones who are speaking out are speaking, like that cardiologist in Tauranga eloquently spoke out. He then left the public health system. He quit public service and went to private. You've got retired physicians, like I think his name is David Galler, who has been outspoken. He's retired now. He's in a position of relative safety. And then you had Pragati up north of us who spoke out about the doctorless hospitals. Bay of Islands, Kaitaia, Dargaville struggling to get staff. And she did that just prior to resigning her role. So I'll leave that for you to decide if you think there's risks in speaking up. I've said enough.
Well, just to make it clear, he's a Northland emergency doctor who is speaking to us tonight in his personal capacity. It is Dr. Gary Payinda. Hey, Gary, thanks so much for joining us. Let me just say, the chat is going, there is lots of love for you and thankfulness to you from me and Chewy, but also from the people watching for coming out and sharing with us tonight. We appreciate it.
Well, I give thanks back to all of them.
All right, Gary, all the best.
Thanks, Gary.
Thank you, guys. See you.